Today, we're going to talk about acne scars. Are there ways to prevent acne scars, and what are the best treatments for them? Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist, and welcome back to my YouTube channel. So acne is one of the most common conditions I see as a dermatologist, and unfortunately one of the negative sequelae of acne, even though acne itself is not dangerous, is scarring. And when it comes to treating acne, really, in my mind, that is what we're trying to prevent, in addition to just the presence of acne. So by definition, a scar is a permanent textural change, a permanent mark left on your skin. And although over time, a lot of the scars do improve and lighten up depending on the extensiveness and the severity of your acne scars, some of them will permanently be there. Even though acne will come and go and acne is relatively treatable, that scarring is often permanent. And so in addition to just treating acne, one of the main goals that I have as a dermatologist is really to appropriately treat the acne to minimize the chances of scarring. So who are at risk for developing acne scars? Well, in general, when we look at everyone that has acne, 40% of individuals with acne period will have scarring. The likelihood of developing scars is higher when you have deeper, more inflammatory acne, but mild acne can also lead to scarring. The most common places we see scarring is often the cheeks and chin, as well as the forehead and temples. But also keep in mind that many individuals with really severe acne will also have acne on the body, and that can be fairly extensive and often uncomfortable. In addition to having severe acne, what we do know from some clinical study is that men have 2 times the risk of getting scarring compared to women, and a delay in seeking proper acne treatment is also another risk factor for developing scars. So why do acne scars occur? We actually don't have a very clear understanding. We do know that most likely it has to do with inflammation that causes enzyme in our skin to be upregulated, and these enzymes are the ones that will eat away at collagen, leading to these textural changes in our skin. Now, we also see acne scarring happen in all sorts of acne, although the severity and extensiveness is higher and deeper in those with more nodulocystic acne. But because it's also seen in mild acne, some speculate that there may be more of a genetic tendency in forming the scarring. But at the end of the day, it has to do with the inflammation that is seen with our acne, inflammation that our body generates to the acne, and therefore decreases the amount of collagen that is produced in this area. So what are the treatments for acne scars? First and foremost, we can't talk about treating acne scars if you have uncontrolled and active acne. You need to make sure that your acne is properly treated and well controlled before you go ahead and seek other treatments for your acne scars. This is where seeing a board-certified dermatologist makes all the difference in the world when it comes to treating your acne and your acne scars. So once your acne is under control, now let's talk about acne scar treatment. Before we dive into the treatment, we have to first identify the type of acne scars you have. And there are a few different types, and really the best acne scar treatment should be personalized and tailored to the type of scars that you have. Furthermore, we need to distinguish between, is it actual scarring versus just color changes, meaning post-inflammatory hyperpigmentation or post-inflammatory erythema. Although scarring and color changes of the skin tend to exist together, for certain individuals, they may just experience discoloration and not true textural changes. And even though the latter may take a long time for it to resolve, it's not a permanent mark left on your skin. So when it comes to acne scars, there are essentially 4 different types of acne scars. The first type of scars is called ice pick scars, and these are relatively less than 2 millimeter indents or depressions on your skin, like little pinholes. They're often deeper, as if someone took an ice pick and jabbed it into your skin. The next type of scars is called rolled scars, and these are much wider, about 4 to 5 millimeters in size, and they're depression in the skin, and the edges often are softer with more of a sloped or rolled border. The third type of scar is called box cut scars, and these range from 1 to 4 millimeters in size, and they're again depressions on your skin. But unlike the rolled scars, there tends to be a little bit deeper, more perpendicular drop to the edges, creating that box cut look. These are probably by far the most common types of scars that we see from acne. And in one individual, you can certainly have a combination of these type of scars that exist. The last type of scars is relatively less common, but can be very uncomfortable, and in a way is really considered more of a medical treatment in the sense it's not purely cosmetic anymore, and it can be much harder to treat, which is hypertrophic and keloid scars. So unlike the previous three where it's a depression on your skin, the hypertrophic and keloid scars are raised bumps on the skin, often very firm. The scar has even become so firm and raised that it extends past the boundary of the initial acne. And although really rare, I have definitely seen extensive keloids and hypertrophic scars from acne, commonly on the jawline and across the back and chest in individuals who are really prone to this type of scarring. So now let's get into the type of procedures that we can use to help improve these scars. First and foremost, understand that over 20 to 30% of your scars will go away on its own, in the sense where it will lighten up slowly over time. For some very superficial mild ones, your body over time may be able to heal and generate collagen and resolve those over time on its own. Using topical retinoids like prescription strength tretinoin, tazarotene, even the over-the-counter retinol over extensive period of time, and we're talking about like 24 weeks or even longer, can certainly help with that. So topical things can be helpful, but again, this really depends on the depth and the extent of your scar. So for the treatments, I'm going to first focus on the ice pick, box cut, and rolled scars because treatments are often similar. The theme when it comes to treating these indented scars are resurfacing procedures. So procedures such as microneedling, Fraxel laser, microdermabrasion, things that will improve the overall texture of your skin. And with these treatments, what they're really trying to tackle is trying to stimulate collagen production, and over time really help to soften those depressions that were created by acne. Now, for rolled scars and box cut scars, laser microneedling are really helpful. And sometimes what we will even do in conjunction is called scar subcision. So using a little needle, a little tool going under the skin and just loosening up that tether scar tissue. So that way, when combined with microneedling or laser, you have a more enhanced outcome. Similarly, there are fillers or even saline that can be injected to again lift up that tether scar tissue to kind of fill in that gap to provide some temporary improvement in the appearance of the scars. For ice pick scars specifically, because they're so narrow in diameter and deep, sometimes little tiny punch excisions, so taking little tiny cookie cutters, these are tools we have in our dermatology office, and cutting those out and creating little line scars in placement can be helpful. Another technique is something called a TCA cross peel. So trichloroacetic acid is a type of chemical that we use for skin rejuvenation and skin resurfacing, and it's a type of chemical peel. But when we use it at very high concentrations and literally apply it with a point of a fine tip needle or a toothpick directly into that hole of the ice pick, similarly, it generates inflammation and wound healing, and over time helps to stimulate collagen and really helps to soften up the depth of the ice pick scar. Various type of scars will exist on the same person. So for example, in my acne patients, I may choose to do TCA chemical peel process to dot in the ice pick scars and then subside some of the rolled and box cut scars. And after that, go over the entire area that's affected with resurfacing laser or microneedling. Now, also keep in mind that when it comes to these treatments, it's not a one-time thing. It will involve often multiple procedures done on a bi-weekly, weekly, monthly basis over the course of many months, and then your skin will start to improve over time. So these can definitely add up and can be quite pricey. If you don't have the money to invest in these procedures, this is what I recommend. Number one, first and foremost, make sure you see a dermatologist and get your acne properly treated. And two, wear sunscreen regularly. Sunscreen will definitely help a lot with the hyperpigmentation, the redness, and will definitely help your skin heal. Three, consider just giving your skin some time and get on a prescription topical retinoid if you can't tolerate that, an over-the-counter retinol. As I mentioned earlier, that is certainly going to be helpful over time with use in improving the textural changes conditions of your skin. And if you don't have the money to invest in cosmetic procedures, topical retinoid certainly is one of the best things that you do have available at your disposal that you can use relatively safely. Now let's talk about hypertrophic and keloid scars. So these are totally different beasts. And what's happening here is that in individuals who are more genetically prone, their body responds to making too much scar tissue, so excessive collagen. And in these situations, it can be very tricky because you have to be careful with treatment in the sense the scars stem from inflammation and trauma to the skin. So things that we do to the skin that we normally would do, like resurfacing laser, scar subcision, excision, may actually cause more scars to occur. So the standard treatment in general, whether the hypertrophic or keloid scars are from acne or just surgery, is intralesional Kenalog injections. So steroid injections into the scars themselves to help soften and reduce their size. And this is often done, as I mentioned earlier, as a medical type of treatment for individuals with these type of scars. And it's usually done on a bi-weekly or monthly basis until the scars soften up. And that really is the most well-studied and most commonly used methods. Off-label, there are things a dermatologist can do, including combination of laser therapy with topical prescription medications, certain types of freezing treatments that we do. We certainly can excise the scars, but because surgery itself may induce more trauma, you can't just have surgery alone. Often surgery is followed by localized radiation. I know as scary as that sounds, but localized radiation, or after surgery, again, intralesional Kenalog injection to really minimize the recurrence of these keloid scars. Lastly, I just want to briefly mention some treatments and recommendations for post-inflammatory hyperpigmentation and post-inflammatory erythema. As I mentioned earlier, although these are not permanent marks left on your skin, can still take a really long time to treat and can be very frustrating. So post-inflammatory hyperpigmentation often is seen in darker skin tone, and it has to do with inflammation from acne that induces melanogenesis, or your skin pigment that is then produced in excess. And because darker skin individuals tend to make more pigment, you see this again in individuals who are of darker skin tone. Post-inflammatory erythema or redness is predominantly seen in individuals with more fair skin. And it's similar, but because there isn't as much melanin, what is happening here is that the inflammation from acne generates more of a vascular response, so there's more redness than there is pigment. Both of these are commonly seen with acne, and you can certainly have, again, these two things in the same individual. When it comes to treating these two discolorations, the most important thing, again, is making sure acne is under control. The next step is to, number one, wear sunscreen. We know that sun plays a huge role in generating inflammation and oxidative stress on your skin, and it's one of the biggest enemies when we are trying to fight uneven skin tone. Then you want to pick products and ingredients that really help to target these concerns. So when it comes to hyperpigmentation, ingredients such as retinoids, niacinamide, tranexamic acid, kojic acid, or butane that help with inhibiting pigment formation are going to be helpful. Make sure that when you are treating, you're not using everything all at once. You want to be really mindful, slowly ease your way into using them, and be patient. Because again, if your skin gets irritated, that inflammation can generate more hyperpigmentation. Now, post-inflammatory erythema redness is slightly different in the sense because it has to do with blood vessels and redness. There's actually limited data on things that can be used topically to help with the redness. The only thing that's been shown in limited studies is topical tranexamic acid. Besides topical tranexamic acid, anti-inflammatory ingredients may help provide some additional benefits for the redness. Things like niacinamide, vitamin C certainly are worth trying if they're not causing irritation on your skin. But keep in mind, because the redness is due to the blood vessels, which is often deeper in the skin, the most effective treatment that will quickly remove the redness would be a series of in-office laser or light treatments that are really the most effective in reducing that post-inflammatory erythema more effectively. Well, that's it, guys. That is my quick rundown of treatments for acne scars and a little bit on how you can tackle treatments at home for the scars as well as uneven skin tone. Please comment below with any questions. I know this is a very big topic. The most important thing I want you guys to take away is please make sure, if you are already seeing scarring, to make sure that your acne is well controlled so that way you don't continue to develop more scarring on your skin. Again, thank you so much for watching this video. If you like this video, please give it a thumbs up and subscribe to my YouTube channel, and I will talk to you guys next time. Bye.